When we first met Bryce's mom, Samantha, her only option from her doctor were medications or tube surgery. She was not on board with that and was determined to find a natural ear infection remedy that would be an effective option to hold off surgery as well as get to the root cause of Bryce's chronic ear infections. She hoped this would stop the seemingly endless cycle of pain, sleepless nights, and antibiotics that she knew were wreaking havoc on her daughter's gut and immune system long term. Because of this, Samantha reached out to our office. Here was the good news. We were able to share with Samantha and now parents watching this video that natural remedies for ear infections do exist. These natural remedies have been around for a long time, and they provide pain relief, reduce inflammation, promote drainage, and work to not just help the child get past an acute ear infection, but prevent further ones as well. So this is for mom and dads who are looking for relief from congestion, ear infections, and overall immune struggles. Ear infections can be a tough call to action for parents. It's common to forget the pain that comes with them once they subside. We're going to go deep into the chronic struggles of ear infections that keep coming back, tubes and other immune challenges that also come with them. In order to best understand the role that natural remedies for ear infections play, we've first got to understand the root causes of ear infections in the first place. And that all starts with what we call plumbing or drainage of the inner ear. And then the signaling and communication of the central nervous system or the brain and the body's immune system. So the number one issue that really causes ear infections in the first place is a buildup of fluid. The entire ENT, or the ear, nose, and throat, respiratory and lymphatic system work just like the plumbing in your house in that it's all linked together. So not only do the nerves and muscles in the inner ear need to be working well and moving fluid along, but it's got to keep moving through the neck and the lymphatic system and throughout the whole body. Put simply, if the body can't expel the viruses and bacteria, it becomes chronically congested with them, leading to ongoing inflammation and recurrent chronic ear infections and other illnesses. Therefore, any natural ear infection remedy must first address the poor drainage and get things moving. Just like a clogged drain in your home can cause buildup or junk and crud, it's honestly the same thing happening in your child's inner ear. Unfortunately, the natural remedies you'll learn about in this video are not the kind of information you'll be told about in your standard pediatrician or ENT's office. While many years ago, the AAP and CDC did finally approve a watch and wait guideline for ear infections, reviewing this 2-page document on the CDC's website is equal parts encouraging since they do recommend at least 2 to 3 days of watch and wait before antibiotics, but it's also very discouraging since the only thing they recommend for treatment without antibiotics is ibuprofen, acetaminophen or Tylenol, fluids, and rest. Just like every single medication out there, ibuprofen and acetaminophen come with plenty of risks themselves, weakening the immune system over time. What's really exciting for parents is this. These natural remedies have been around for years and have helped countless kids stop the endless cycle of ear infections, antibiotics, and ear tube surgeries. While the short list of natural remedies can include warm or cold compresses, rest, vitamin D, and distraction, salt water, hydrogen peroxide, ginger, naturopathic eardrops, changing sleep positions. Most parents have tried these, and while they may help at the moment, if the ear infections continue to persist, we want to look deeper at what can be done to address the cause. So I want to dig into neurologically focused chiropractic care and how it can be the key for not only drainage, but the signaling and communication of the entire immune system. Finding the root cause begins with a deep dive into your child's case history. And here's what we continually find in children struggling with chronic ear infections. Birth interventions and trauma such as forceps, vacuum extraction, induction, and C-section delivery. Health challenges as an infant, such as colic, reflux, and constipation, early exposure to antibiotics and steroid-based medications, and a high diet in sugar, processed foods, dairy, grains, gluten, all the things. Each of those early stressors increases the tension and stress on the nervous system, leaving it stuck in a more sustained sympathetic fight or flight response. That sustained sympathetic and subluxation then increases the tone and tension on all of the soft tissues and muscles in the upper neck, including the tensor veli palatini muscle. It's our Italian friend, which then gets too tight and wound up and limits proper drainage of the eustachian tube. Additionally, sustained sympathetic tone creates a condition called dysautonomia, which leaves the body in a more inflammatory state and weakens the immune response as a whole. This leaves the ears and immune system facing two main problems: unable to fully drain the fluid from the ears, and a pro-inflammatory or weakened immune state, which creates more mucus to pool in the ears. But the good news is chiropractic adjustments help with both. Neurologically focused chiropractic has been shown to have an incredible impact on not only the prevention of ear infections, but on helping kids get better when the ear infection is the worst. In retrospective studies, 93% of kids with acute ear infections improved after chiropractic care. When Samantha, Bryce's mom, first found neurologically focused chiropractic care, she truthfully wasn't exactly sure how long it would take or what exactly her care plan would be focused on. But after our initial consultation and hearing the 5-step clinical process, she knew she was in the right place. After deep diving into Bryce's history, we found that she had a difficult birth and delivery. She snored when she slept and had a very weak immune system from a young age. Next, Bryce's insight scans showed that she had extra tension in her upper cervical spine, which is this part right here, right around the muscles that help drainage from the sinuses into the neck and lymph nodes. It was holding fluid where it shouldn't be. Putting her clinical history and scan findings together, we built a care plan specifically for her. After just a few months, she was entirely in the clear from ear infections and on the path to healthy and thriving childhood. When we guided Samantha through Bryce's insight scans at the reported finding visit, it was eye-opening to say the least, to see the exact area the struggle was coming from. Here's what Mom said after Bryce's first adjustment. After Bryce's first adjustment, she fell asleep in the car. She has never been a car napper, not even as a baby. Then she took 3 more naps that first week. It has been probably 2 years since she's taken consistent naps, and after about 2 weeks of adjustments, she started sleeping through the night. When she gets sick, the symptoms are less severe and shorter-lived, and no more ear infections. She is slowly starting to let her true personality shine outside of their house, and others are finally able to see and experience their very best girl. Yes, neurologically focused chiropractic care may not be on every Google search result. Still, it has proven very effective in helping children get past the cycle of chronic ear infections. If, after hearing Bryce's story and learning about neurologically focused pediatric chiropractic, you think that subluxation may be playing a role in your child's chronic ear infections, we would love to help. Click on the article in our bio or go to our website.